Each year, more than 12 million cosmetic procedures are performed. And while most people are thrilled with their transformation, today we're going to bring you the stories of patients whose pursuit for perfection fell flat, plastic surgery horrors, and how to avoid them. Next on Ask Dr. Manny. Have you ever looked in the mirror and thought, I wish I could change this or that? If you have, you're not alone. In 2008, Americans spent a mind-boggling $10.3 billion getting nipped and tucked. But as you're about to see, plastic surgery doesn't always go the way it should, just as these two women.
I can't live like this. I'm like, this is like, I look like a freak. People were always nice and said it didn't look terrible. It looked terrible.
These women have never met, but they share the pain of botched plastic surgeries. After a car accident, then 18-year-old Brene Brenner went under the knife to repair her nose. For the next 30 years, she was unhappy with her decision. Judy Crepin lost 140 pounds, and her quest for a better shape led her on a journey that ended with severely deformed breasts.
My right breast is almost 3.5 inches lower than my left breast. I said the left breast is up on the left-hand side. I said, and the side of it is shaped like a football and it's hanging underneath of my left arm.
Multiple surgical fixes left Judy's body mutilated. Her original surgery in 2001 was revised because her implants were too small, and when they were replaced, they were too large. After those 3 surgeries, she had at least 4 more to repair the damage, including busted stitches and infections. The financial cost, over $30,000. And at one point, she lived without implants while her tissues healed.
For about 4.5 months, I went without a right breast. So I had to use gauze and padding, and I had to try to make everything contour, and it was really difficult.
Judy searched for doctors with the ability to make her look human again, but no doctors would help her, something 48-year-old Brene Brenner identified with.
I did check out a few surgeons in the city, but the ones that didn't want ridiculous money didn't even want to touch it because they said it had been too damaged. So I kind of figured this was my lot in life.
After her initial surgery in 1979, Brene's nose was never the same and got worse over the years.
Imagine having to wake up every day and look at that in the mirror, and or if somebody's taking photos of you, cringing every time you looked at a photo of yourself. So I started taking myself out of photos.
Her nose haunted her, especially as she planned her wedding. The thought of immortalizing her imperfection in a wedding album made her sick, and she almost didn't get married. Eventually, she hired a makeup artist.
It was amazing. I didn't care what she was going to charge me. She had to be there, and she was there the entire time during all the photographs, every 2 seconds, touching it up with a specific makeup.
Brene had dodged one bullet, but history would repeat itself after she and her husband started a family, and their son was of bar mitzvah age.
I didn't want a makeup artist. I wanted it all better. I was tired of this. I had 2 other children coming behind him, and I knew this was going to be, and then they were going to get married, and you know, I just hoped maybe I could find somebody now.
And this time around, she found a surgeon who would help her.
How you feeling?
I'm doing good.
Dr. Sam Risk took on Brene's case.
I took banked rib, which is rib that's been processed with, approved methods, and we used that cartilage to correct multiple areas of collapse in her nose to make her breathe better, and also to make her nose look straighter, more defined, and to correct the saddle ski-sloped nose that she had.
I had the bar mitzvah. I took pictures. I took hundreds of pictures of me. My husband made fun of me because I was the photographer. I told him to take a lot of pictures of me, and I said I was making up for lost time. Now I look in the mirror and I wonder, I'm like, what a beautiful nose. Because for me, it's perfect.
I think I might take this dress in case we go out.
Judy Crepin also wanted perfection, but came to terms with her disfigured body and thought this was as good as it was going to get. Then she met Dr. Tracy Pfeiffer.
Hi, Dr. Pfeiffer.
How are you today?
Good. It's nice to see you.
You too.
Oh, Judy's case was by far the most severe case that I've ever seen. She had really significant asymmetries. Her tissues had been damaged from multiple surgeries, plus her tissue had been stretched out from having large implants in for a long period of time. She had scar tissue from her previous surgeries.
Dr. Pfeiffer gave Judy much smaller implants, but they provided a big boost to her self-esteem.
I felt like a human being again. I wasn't afraid to put on a bathing suit top. I wasn't afraid to wear a strapless dress. You know, my life had totally turned around 100%.
Happy endings, but not everyone is so lucky. Some botched plastic surgery is beyond repair, leaving patients disfigured for life. So it's important to do your homework before electing to have surgery. Here's my checklist. Pay attention. It sounds basic, but make sure your surgeon is board certified. If you're having facial surgery, your doctor should also belong to the otolaryngology board. Check with your state's medical board to see if the doctor has any medical malpractices and to confirm that he or she has a license to practice medicine. Make sure the doctor has privileges to perform that procedure in a hospital. If they don't, that is a safety issue. Also ask other doctors and patients for referrals. And make it a priority to talk to patients who underwent similar procedures to the one you're looking into. Coming up, more questions you should ask yourself to make sure you're ready mentally for that change. Plus, making over your dog, pet plastic surgery is more common than you think. So you checked out surgeons and talked to patients. But before you have plastic surgery, you need to look into the mirror and ask yourself some questions. So for that, we turn to psychiatrist Dr. Dale Archer. Thank you for being here, sir. I think that anybody who's getting plastic surgery, the first doc that they should talk to is somebody like you. I'm telling you, because the psychological impacts of either getting surgery or the surgery going wrong or the expectations that you have for yourself could be huge. So tell me some tips. How do you get ready psychologically for plastic surgery?
Well, I mean, there's several things, but I think first and foremost, you have to know what you want. So you don't want to go to a plastic surgeon and say, I want to look better, I want to look younger, do something to me. You have to decide yourself what you want. And if you don't know, you shouldn't be having the surgery. So that's very important. Also, you got to do your homework. You got to look at the doctor. You got to make sure you like him, you trust him. You got to make sure he's qualified. You also have to look at the financial aspect, make sure you can afford it, and you have to talk to family and friends about not only what their opinion are, but also if they can help you when you have the surgery, because you can be looking at 2 or 3 weeks of recovery time.
Now, I got to tell you, I have met many women, because I happen to be a women's doctor,
right,
who have undergone plastic surgery.
Yes.
I can tell you that I haven't met one that was satisfied. Now, they'll tell you they're satisfied right from the beginning because they just don't want to have egg in their face.
Yeah.
But I haven't met one that is satisfied, which comes to the fundamental issue that you said. Why do you get it in the first place?
Right.
But the pressure, Doc, as we get older, because, look, I'm no spring chicken.
Well, look, I'm right there with you
Look
now.
at your hair. I wish I had hair like that. I want to see the whatever, but then I think about the plugs sticking out.
You don't wish you had wrinkles like this, though.
But, the pressure of life as you get older, the magazines,
right,
the television, every show you see is about all of these women and men transforming themselves.
Sure.
How do you deal with that pressure?
Well, first of all, you have to understand that you need to have plastic surgery for you, not because of what you've seen on TV, not because of a magazine, and not because you want to look like a supermodel, because that's not going to happen. And self-esteem is really an issue that needs to be addressed in everyone, because the bottom line is low self-esteem is a criteria for clinical depression. And clinical depression is the #1 predictor of folks that do poorly in plastic surgery and don't like the results, not because the surgery is botched, but because they're unhappy with everything in their life and they think the plastic surgery is going to be a magic pill that's going to make them better across the board. Of course, all you're doing is changing a physical characteristic. So that's a hugely important issue, and it all goes into expectations. What do you expect?
Right, and how do you deal with expectations? I mean, how do you set your priorities for
you gotta
expectations?
you got to have realistic expectations.
Right.
And that means you need to understand you are altering a physical characteristic. This is not going to get you promoted. This is not going to get you more dates. This is not going to fix your marriage. This isn't going to do any of that. All it's going to do is change a criteria which hopefully you've thought about and said, this is what I want to get done.
All right. Now, there are folks out there, believe it or not, that are addicted to plastic surgery.
Yes.
I have met a few.
Yes. Me too.
Okay.
I've treated it.
And let me tell you, I even put the Botox thing into the whole thing. I know a lot of people get their Botox every 6 months or so, and the Ritalin, whatever the heck they get in their faces. But how do you deal with addictions, and how do you know that, or your spouse or yourself or somebody you love or care for is addicted to plastic surgery?
Well, look, we've really lately, over the last 10 years, have changed our view of addiction tremendously. And we understand now that all addictions are related. And there's a brain chemical called dopamine, which is the pleasure reward chemical in the brain. And I don't care whether it's internet, gambling, sex, shopping, alcohol, drugs, or plastic surgery, the addiction is the same across the board. And in plastic surgery, this is how it happens. You're not feeling too good about yourself. You find a flaw, you say, I want to get it fixed. You have the surgery, you feel better because you look better, but it only lasts for a while. You start feeling bad again, you find another flaw, you have another surgery. After 2 or 3 or 4, the brain starts saying, I feel better after surgery, and when I don't have it, I feel bad. So you get withdrawal and cravings. You actually set yourself up psychologically for this addiction. And I've personally treated patients that have had over 30 plastic surgeries, usually in a 5 or 6 year period of time. So this is a very, very real phenomenon.
But aren't the doctors to blame in that kind of scenario? Because I got to tell you, I have a lot of plastic surgeon friends. Sometimes, you know, they go in and they say, well, why don't you do this? Why do you do this? I have a guy who saw my face. I said, hey, what do you think? You know, because I keep thinking my nose is too big, which, by the way, it is. You know, gravity has set in, and, you know, I got this thing. And I said, well, maybe, and I said, no, but you know what? We should take some fat off your neck, and then, you know, we can lift your ears a little bit, and that's going to give you a lift. And before you know it, they're selling you 3 or 4 things.
No doubt. And I think that, as I said, you have to know what you want. But to the plastic surgeon's credit, the patients that I got that referred to me had multiple surgeries.
So they go shopping around.
Well, no, and the surgeon said, you know what? You need to see a psychiatrist. I want to get this checked out because you've had one after another. There may be something else going on here. Now, unfortunately, all doctors don't do that. And a lot of them, as you say, they don't do what you want, they do what they want, and they actually almost sell you on the fact that I can make you better, but you got to have 1, 2, 3, 4 procedures, and we can do it.
All right, Doctor D, give me one last advice for people listening out there about this whole mental issue.
I think that I would say that you have to understand your motivation for having plastic surgery. And you have to understand that basically you're looking at a definition that society gives to attractive, normal level of attractiveness. But a couple hundred years ago, this level was very, very different. Then it was round features and pleasingly plump was the norm. So you're trying to cram yourself into this box of normal, and your features may not fit there. Your body type, your face may not fit there. So I tell people, my patients, that, you know, if you try to please everyone and conform to normal, you run the risk of losing your uniqueness and hence your greatness.
And you got to please yourself first. Dr. D, thank you for joining us. And you can get in touch with him through his website, drdalearcher.com. Up next, if you want to look younger but don't want to go into the operating room, there are options to help you grow old gracefully. For all of us 50-somethings who want to turn back the hand of time, there are plenty of natural options out there. Joining me now is author of Redesigning 50, the No Plastic Surgery Guide to 21st Century Age Defiance, Os Garcia. My friend Os Garcia. I got to tell you, this book, Everybody has to get this book because this book tells you the secrets that you need to stay young, you know, because half of the book you talk about alternative ways to sort of turn back the clock.
That's right.
You know, so let's go through some of the things because, you know, the whole show is about plastic surgery, but one of the things that you bring into the table is the whole aspect how you could eat your way to a more beautiful body.
Correct.
I, of course, eat my way through a bigger and fatter body, but that's my problem.
Right.
Tell me some things about that.
Well, I think people can do one of two things. You can eat your way to an unhealthy body, premature aging, infirmity way before your time, or you can eat to have a somewhat youthful body indefinitely. So I'm interested not only in living longer, but the quality of life, whether or not you can stay very fit as the years go on into your 50s, 60s, and beyond, a good active sexual life, let's say, maintaining your immunity, dodging a couple of bullets along the way, Manny.
Yeah.
Heart disease, diabetes, cancer, and so on. So you can eat in large measure to maintain an indefinite well-being.
So give me examples of some foods that you kind of are very bullish in making you, you know, get that whole thing going.
I think when you look at certain societies where people and cultures live long, you know, and live qualitatively good long lives, you know, you can look at the Greek Mediterraneans. We were talking about this a little bit before.
Yeah.
Olive oil is critical. A little bit of alcohol, red wine for the resveratrol seems to be very good for reducing illness. Seafood, fish, that's central to what I believe in. And eating a lot of fruits and vegetables. Central to what I believe in is having a lot of antioxidants, the ones that you find in all the multicolored fruits and vegetables. These are the main things that you need to concentrate on.
Your book is sort of divided. The first half is this whole dieting and how it improves your metabolism and
That's
improves
right.
your you know, your immune system, which is very important. The second half, you go a little bit about rejuvenation.
Correct.
Which is, I guess, the word rejuvenation to me as I read it is you want to sort of reshape, change the cellular structure of your body
Yes.
in order to kind of look a little bit younger, at least, right?
Yeah, that's correct.
So let's talk about rejuvenation. How does that, what does that entail?
Well, let's just say that you have to be fit at any age, no matter what you do. I started running back in the 1970s, and I've been running for over 30 years. So you got to work out. That's one of the things that keeps you very youthful. The Wall Street Journal today ran a significant article on the benefits of exercise on blood pressure, mood, metabolism, many aspects of how we stay well. So part of rejuvenation is being fit. You don't work out as hard necessarily, but you work out often and frequently. You can't eat as much as we used to either. You have to moderate the volume of food that you eat.
How do you jump that? Because, you know, for people that don't exercise, and I think everybody would acknowledge, even people that do not exercise, that exercise is very good for you.
Right.
But there's a psychological block that gets you to exercise. I mean, some people try it for one day and they say, oh my God, this hurts so much. My arms hurt, my legs hurt. I don't feel like doing this. And they ultimately give it up because they say, look, it's just too hard. We get it that it's good for you, but it's just so. How do you deal with that psychological barrier? I mean, what can people do to say, okay, I know it hurts, but look at the achievements that I did, or what are the gratifications that they can do, especially at the beginning,
Certainly.
to get to exercise?
Well, this is a question of lifestyle, and what is it that you're looking for? What do you want? So it's not about going to the gym and working out really hard 3 or 4 times a week when you're in your 40s, 50s, and 60s. But it's about working out intelligently. It's maybe getting a trainer. It's maybe joining a fitness club where you're comfortable, you fit in, whether it's a Y or a local gym where you can go and do something. Even walking, Manny, 20 minutes, 30 minutes a day, walking has tremendous benefits as a form of exercise. The activities that you do around your home, so long as they build up to something where you notice that you're a little bit stronger every day. And psychologically, you know that if you don't work out, it's going to cost you more in the end. So in terms of prevention, you do need to work out irregularly, let's say, but you need to do it.
In your book, you talk about how people should face up to their age. You know? Look, you're 50. Face it, you're 50. You know, don't pretend, because I think that a lot of you know, a lot of the problems that we have with this obsession about plastic surgery is trying to kind of not only erase your physical appearance, but try to think that through plastic surgery you're going to go back and be 20 again.
Correct. But I think that you can be realistic and understand that we're vain by nature. We want to look good. You want to look good because you're in a society that puts a lot of emphasis on your appearance.
Right.
If you want to stay relevant in the marketplace, you want to look fit, you want to be lean, but you don't need to be grotesque in terms of your approaches. How you manage it through adequate stress management, sleep hygiene, what you do with your diet, creating a spa day every week. A good active sexual life seems to turn out as you get older.
I like that one.
to have a profound effect on how you look.
Right.
Cosmeceuticals, the use of certain really natural products that you can use externally. So it's an ongoing way that you regulate everything. So it's a lifestyle. And that's the important thing I want to point out to you, Manny.
Oz, thank you so much for coming to the program and all of that great information. And coming up next, believe it or not, even man's best friend is getting plastic surgery. Find out why some poochers are getting nose jobs and facelifts. Welcome back. Just when you thought you heard it all, you haven't, unless you heard about pet plastic surgery. I'm not kidding. Some pets are getting nipped, tucked, and plugged. Check it out.
Eye lifts, breast reductions, nose jobs, facelifts.
I'm bringing sexy back.
Sexy is definitely making a comeback these days, but it seems this kind of sexy is all about style of the doggy kind. That's right, it seems cosmetic surgery has moved from people to pooches.
I've been asked for Botox, collagen, Restylane.
Pet owners all over are having procedures done on their dogs, from nose jobs to facelifts. Dr. Alan Schulman says it's more popular than you think.
When you tell people that you're doing these types of dermatologic, reconstructive, or plastic types of procedures, they're absolutely blown away that animals are receiving these types of surgeries.
So are people barking up the wrong tree getting their pets plastic surgery? Well, it may not be as ridiculous as it sounds.
What has to be understood is that when we're doing an eye lift, we're not trying to make a 10-year-old dog look like he's 5. We're doing it to save vision and keep them out of pain and discomfort.
According to the doctor, many dogs benefit tremendously from plastic surgery. Nose jobs can help them with breathing. A wrinkly dog like a Shar-Pei might have a hard time seeing, but could get a better view with some of those wrinkles removed.
These are really being done for true medical benefits and not for as a beautifying sort of a procedure. I think that if you're truly dealing with an ethical veterinarian who cares about your animal, they will not perform these types of procedures because just like in the human field, there's a risk with any anesthetic.
Recovery time can be long and painful, so before you schedule your pet's nip or tuck, just remember, surgery, even for a dog, is no walk in the park.
We have covered a lot of ground in today's show, from plastic surgery nightmares to making sure you're mentally ready to change your appearance, and alternative and natural options to grow old gracefully. But if there's one lesson you should take away, I hope, is this: make sure you do your homework. Find a reputable surgeon, get referrals, and know the risk you're taking, because once you go under the knife, there's no turning back. Remember to check out FoxNews.com for more on today's topic. That's all for now. Thank you so much for joining us. I'm Dr. Manny, and I'll see you next week.